Hello, welcome back. Do children get gallstones? That is a video topic today we're going to discuss. Before that, do you know out of 1 million children born, 10 children doesn't have gallbladders. So they are born without gallbladder and they live a normal life with some problems. But do children get gallstones? Definitely they can get. Though it's not like adults, where out of 10 people, 2 people have gallstone disease. But children, it's not that common, but it is increasingly getting common, very common. Reason being the sedentary lifestyle, obesity, weight gain. Children are now chubby, obese, and high fatty meal, especially cheese. You know, ghee, pizzas with cheese. Late night food, very important. Very late night food, like they and nobody's going to bed before 12 o'clock. And late night food like biryanis, pizzas. That is all increasing. The lifestyle is changing, so children also getting very commonly gallstones. But those days, the reason being different is all because of hemolytic anemia, like sickle cell anemia, beta thalassemia, or hereditary spherocytosis. These are all where hemolytic anemia, where the red cells get destroyed, and they liberate the pigments, or the from that the stones form. They are called pigment stones. Usually we know gallstones as a cholesterol stone, pigment stones, and mixer stones. So cholesterol stones are very common in adult, and pigment stones are very common in children. But this hemolytic anemia is becoming lesser and lesser, and the lifestyle changes. All these obesity is causing more gallstones in children. And apart from that, suppose a child with Crohn's disease, like IBD, they may get gallstones and other conditions, like parental nutrition. For some reason, they're not able to have food orally, but they depend on parental nutrition, like IV nutrition. They also can get very commonly. Okay, what are the signs and symptoms? It's the same thing like the adult. Like they can get pain, abdomen, vomiting, nausea, and pain is more increasing after food, especially fatty meal, and pain usually in the center to the right side, going back. These all usually, and very importantly, when it gets infected, they get abdomen pain, fever, and chills. Fever, chills with abdomen pain, mostly in children. It could be gallstones. So, so how to diagnose this? Once you go to the doctor, they will examine, and they will when they ask history and examination, will given some idea to the doctors, and they may order for a scan, ultrasound scan, or a CT or MRI to diagnose the gallstone. Once the stone is confirmed and the gallbladder is infected, what is the treatment? It's like the same thing like adults. So we have to remove the gallbladder through laparoscopically with the stone completely. So most of the parents will ask, okay, if I remove the gallbladder, what will happen? And if it's a very important digestive organ, will it affect the child's growth? Mostly no. Initially, they may have some digestive issues, but it will not cause that much of problem. They can have a very normal life. And apart from this, children can get acalculous cholecystitis without gallbladder stone. Gallbladder disease can happen, like infection can happen, especially if the child is has a prolonged history of hospital admission, ICU admission. They can get without gallstone. Uh, Acalculous cholecystitis, where it's the infected gallbladder becomes non-functional, so they have to remove it. And there are other conditions like dyskinetic gallbladder, where the gallbladder function itself is contractile force itself is gone. So, what are the treatment? Any gallbladder disease, whether it's adult or child, the basic minimum treatment for the gallbladder disease is to remove it completely. Of course, laparoscopically or robotically. So, if any of children have these things, you have to consult your doctor. He can give the proper solution. Thank you.